back to our new series exploring early ASD awareness. As usual, I'm Fareen and I'll be your host for today. In today's episode, we will be focusing on communication red flags in infants. Do note that when we talk about communication red flags in infants, we're looking at those subtle hints that might indicate a developmental difference. Remember, it's not about being alarmed, but rather about being informed and proactive. Before we begin, don't forget to hit the subscribe button and stay updated on all the valuable information about our center and discover tips and strategies to support your child's development. So let's get right to it. Early communication signs to take note of: limited or lack of eye contact. The first communication red flags in infants that you should be wary of is when your child displays limited or lack of eye contact. Eye contact is a fundamental social communication skill that helps infants connect with caregivers and navigate social interactions. Limited or no eye contact in an infant might indicate challenges in forming these early social bonds, which are crucial for emotional and social development. Delay in babbling. The second communication red flag in infants you should be wary of is if your child has a delay in babbling. Babbling is an essential precursor to speech and language development. It involves experimenting with different sounds and syllables. A delay in babbling or limited vocalizations may suggest difficulties in the progression towards expressive language and communication. Absence of gestures. The third communication red flag in infants you should be wary of is if your child does not do any gesture movements. Gestures such as pointing or waving are important nonverbal ways for infants to communicate their needs or interests before they can speak. The absence of these gestures by 12 months may indicate challenges in using these early communication tools. Limited response to name. Responding to one's name is a basic social skill that demonstrates awareness of the surrounding environment and engagement with others. A lack of response to their name being called may raise concerns about a child's auditory processing or their ability to engage socially. Ways to encourage communication skills. Now that you've learned some of the communication red flags in infants, we'll be providing you tips to foster communication between you and your child. Before we begin, it's important to remember that every interaction is an opportunity for communication development. Always be patient, celebrate every small milestone, and seek professional guidance if you have concerns about your child's communication skills. Hence, here are 4 things that you can do. Number 1. Establish face-to-face interaction. Creating face-to-face interactions involves getting down to your baby's eye level during playtime, maintaining eye contact, and engaging in interactive facial expressions. These interactions foster a strong emotional connection and support social development. For instance, smiling using animated facial expressions and responding to your baby's cues contribute to positive and engaging face-to-face exchanges, enhancing bonding and communication as well. Number 2. Narrate daily activities. Narrating daily activities involves talking to your baby while engaging in routine tasks like changing diapers or preparing meals. This practice helps to expose babies or your infant child to language and everyday vocabulary. Using simple language, repeating keywords, and employing a sing-song tone can capture your baby's attention, making these interactions engaging and educational. Number 3. Respond to babbling. Encouraging responses to your baby's babbling helps in fostering early communication skills. When your baby babbles, responding enthusiastically and mimicking their sounds creates a conversational atmosphere. Treating babbling as a conversation starter facilitates turn-taking and lays the groundwork for early conversational skills. In summary, remember, it's important to note that these communication red flags, while significant, are not conclusive indicators of ASD by themselves. Many children may display behaviors within the normal range of development. If you notice these red flags or have concerns about your child's development, it's advisable to consult healthcare professionals such as pediatricians or developmental specialists for a comprehensive assessment. And there you have it! We have come to the end of this video. Thank you for being with us, and we trust you found the information valuable. Stay tuned for next week's episode where we'll delve into the significance of joint attention. Feel free to share and subscribe to our YouTube channel for more insightful content. We look forward to having you with us again. Bye!